Kia ora koutou. Welcome everybody to our lunchtime webinar, first Tuesday of the month, where we have a member of nursing, or one of the professions, one of the health professions from different areas, talking about a topic which they have done some study on, or have been very involved with. And today that is Regan Gilchrist has kindly come along to talk to us. Regan is a registered nurse who works in aged residential care and has been there his whole nursing career. Good on you. At present, he's the clinical manager of Ross Home, a 124-bed care home in Dunedin. Regan's research, which he's going to talk about today, was completed as part of his master's degree, and he seeks to explore the important relationship between knowledge and attitudes around HIV and how this may impact future care as individuals age and are aging with HIV. Fascinating and not very well known about topic, Regan, and thank you very much for coming along, and I will now hand over to you. Kia ora.
Wonderful. Kia ora. Thank you so much, Lorraine, for that introduction, and also the opportunity to present today. It's the great thing about research is being able to present the findings once you get to the end of the road. Yeah, so I'll run through with the time I have, and just wanting to give an acknowledgement to Health New Zealand for running this webinar for development. It's a really great thing. As Lorraine said, I do work in the aged care space. So I work down as a clinical manager at Ross Home, and I've been in the aged care space forever. So certainly an area that I'm passionate about. So what I'll run through today is just giving a bit of an introduction. So a bit of the how and why about sort of why this study was important and how it led me to it. Just go over some background, some results, and also some messages, and we'll go from there. And happy for some questions at the end as well. So HIV is not something new. You know, we certainly have, I've been hearing of this term pretty much since the late 1980s, so around 1985 when it first hit its peak. And certainly in those early years, a lot of people died from HIV, what led to AIDS-defining illnesses. But now what we see is people are living a lot longer, and that's due to several things. But now we certainly understand a lot more about how we manage HIV, how we treat it. We understand a lot more how it works in the body, and we've had significant developments in biomedicine, such as around the medications that we have to manage it. So now what we see is people are aging with it. People are having quite similar life expectancies to those who don't have HIV. And it's a unique situation because it's a population that never used to age. What we do know in New Zealand is that, as our statistics show us, that 62% of people living with HIV in New Zealand are over the age of 50, and that's certainly expected to increase. So certainly by 2030, that's actually anticipated to increase to around 72%. And we know we already have an aging population, so the potential demand on aged care services for these individuals may be quite common. We do know while people live longer with HIV, they are also at a higher risk of other health conditions, other comorbidities, and that's due to several factors. It can be due to the treatment they've been put on for their HIV, it can be the initial HIV diagnosis. So the demand on care is likely going to be required. What we do know, and this is a very big thing for people living with HIV, is stigma. And it is the number one barrier to safe care. And certainly some research has been done in New Zealand that sort of surveyed about 200 people living with HIV and asked about their experiences. And over half of that sample indicated that they had experienced stigma from a healthcare worker in New Zealand. We also have seen some research that has happened overseas in Australia that has really identified that aged residential care would not be ready to respond to the needs of those living with HIV. And in 2022, one of our wonderful stakeholder organisations, Positive Women, who support women and children living with HIV based in Auckland, they started looking at the lived experience of people aging with HIV and what that sort of looked at. And so this research then taps into the staff who work in aged care and what they think and what they know about HIV. Cool. So in terms of the study aims, really the priority of the study really was to understand the needs of the art community, with the thinking if we can understand the needs and the requirements, then we can inform interventions, we can inform support with the outcome of that reduction of stigma. And so two really main aims we really put out is sort of wanting to know the level of HIV knowledge in aged care staff and also the level of HIV related stigma, which we'll explore in a minute. So in terms of our methods, what's a quantitative design? So it was done by an online survey, which we used the Qualtrics platform for. We did use paper copies as well, and they were far more favourable by the staff in the facilities. So we had a lot that had to be manually entered. We opened it up to only facilities in the Dunedin areas. That was 26 potential facilities, and who we were eligible for inclusion were our healthcare workforce. So all of our nursing workforce, as well as caregivers and allied health staff. In terms of our recruitment, I discussed the study initially at one of Sharon Adler's meetings last year, and then from there I did in-person visits to most facilities. Normally a staff meeting or a handover time where we talked about the study, and then the link to the questionnaire shortly followed after that, which included the consent and information about the study. So in terms of designing that survey, we were quite fortunate. There's lots of tools out there that have been done typically in the United States, sort of about looking at HIV knowledge and stigma. So we use a knowledge scale as the first part of our survey. And as you can see, that survey is 2002, so it did have to be modified in order to include some of the developments that we've sort of seen in the last 5 to 10 years with HIV management. We added the stigma scale, Wagner scale, and we also modified that significantly as well with the author's permission to remove lots of the legal liability statements that were prominent to the context it was designed in the United States. And we also changed the terminology a bit in using words such as residents rather than patients, because that's more appropriate to the aged care environment. We inquired around all those standard characteristics, but of interest, we were really keen to know if anyone had received any training around HIV. And if they had received any training, what was that training and what did it look like? And equally interested in how long people had been in New Zealand, because we do acknowledge that aged care does have a higher proportion of an international workforce as nursing does in general. We also sought some feedback from our stakeholder organisations, Body Positive and Positive Women, who gave some really great feedback around our wording, but really felt some additional questions around disclosure and worry should be added, because they were quite prominent things for those living with HIV. In terms of our participants, so we had 11 facilities that signed up to the project, which is not bad for the size of Dunedin, and 184 completed surveys. In terms of our participants, so I have highlighted a few aspects here. So had a higher proportion of females who completed our surveys, around 85%. In terms of our ethnicity, New Zealand Europeans were obviously the highest. We did have a small proportion of Māori at 5.5%. And again, looking at those numbers with our overseas staff, which again, I think supports our workforce numbers in aged care. Occupations, healthcare assistants, caregivers, kaifina, that they make up the largest proportion of our workforce in aged care. So those numbers are not surprising. But what is really good to see is we had around 13 nurse managers around the area who participated, which was really great to see. So this next section around knowledge, so this was really based on, there were 13 questions and 13 statements in this section that asked survey participants to either say they thought it was true, was false, or they didn't know. I haven't pulled all 13 here, just the ones that appealed to me. So certainly, it was really great to see a large proportion of our sample did acknowledge that you cannot get HIV by sitting in a swimming tub or a swimming pool or a hot tub with someone. So that was great to see. But what we did see in terms of our lower levels of knowledge is around those changes we have seen in HIV-related care, such as the concept if people have an undetectable viral load, they can't transmit the virus, and again that there is certain meds out there that can be used to prevent getting HIV. And again, these are changes that we have seen sort of in the last 5 to 10 years, and so potentially that is why there is that lower knowledge. Stigma was our next section. So stigma was broken down into 3 categories, and the average stigma score of 81.5 was not that bad if you can look at the highest possible score you could get, which was 180. but you will break down into those three categories of what that actually came down to. So prejudice statements, this was quite low in terms of the three categories. Now we saw lower proportions of having high percentages of those who agreed with these statements. But what is really common, and we see it in the literature quite often, is a fear of occupational exposure, so a fear that, our standard precautions would not be enough in terms of getting HIV from a resident, worrying that one set of gloves isn't enough, and so you want to wear 2 sets of gloves. It's very common in the literature as well. And just a general consensus that they're concerned about worrying about contracting it from residents. Yeah. So our stereotyping statements, we saw a much larger proportion of agreeing statements in this category, and a lot of it does come down to sort of the moral view of HIV. So certainly, we did see, over 50% of our sample did feel that if people were to act responsibly, they wouldn't contract HIV. That people have engaged in risky activity despite knowing the risks. That's again just over 40%. And that people would get HIV if they had sex with fewer people. So just indicating how people are thinking with that. And then our last bit was around discrimination. Of interest in this section, the legal right to refuse, we had added these questions in, and there was a high proportion of people who had actually felt that they could refuse if they felt uncomfortable, and that they had that legal right. So, just over 45% of people feeling if they felt uncomfortable, they had the legal right to refuse care, which I think is an interesting thing for us to be aware of. Because obviously we do know that that is not quite an option in healthcare. So I think it's important that we understand that that's how people are thinking. We added these in, so as I mentioned, we got some consultation feedback from our 2 stakeholder organisations, and they wanted us to add some disclosure questions, because that's a really big thing for people living with HIV, around their status being shared unnecessarily so. Over 80% of the sample felt that they should be informed if there was a resident living with HIV in their facility. But what really was highlighted in this section was around sort of, our quite intensive isolation management things we can sometimes use for things like COVID or norovirus, and the feeling that this should also happen, so people with HIV should be bathed separately or laundry done separately, around 35% of the sample felt that should happen. Disposable dishes and cutlery, again, around 25% of the sample did feel that as well. The last section of our survey talked about worry, and so what we added is we added 4 tasks that I felt were really common in aged care, and asked people how worried they would feel, and putting it on a scale of either not worried at all to extremely worried. And as we can see, the interventions resulting in exposure to blood or bodily fluids, wound care, they are the ones that are making people quite worried. We're seeing less worry with touching clothing or taking a temperature, but when there is blood or bodily fluid involved, that is creating quite a high degree of worry in some of our participants. What we did add at the end of the survey also, so while primarily this study was a quantitative design in nature, we did add the option at the end of the survey if people had any comments or any thoughts. And we got some really good feedback from them, and we were able to actually pull out some themes. So these had not gone through thematic analysis, but essentially just sort of exploring what they had meant. So that first thought that people living with HIV deserve the right to live in care, which I think is really important. It is a bit in conflict with some of the results we've just talked about. However, there is an acknowledgement that it's good to shine a light on HIV in the ARC sector. So people living with HIV don't need to fear coming into care, and staff don't need to fear the resident. So I think that is really important. And then our second theme talks about education and awareness of HIV in staff. And certainly when we look at our knowledge results, this is verified, and more education is needed on the subject, and a lot of stigma does exist. So I think what it does show is there's a willingness for the professional development, which is really important in order to support these individuals. So just to sum up, so some of the key messages that really came out of it, that was discussed in my dissertation. I guess New Zealand's had quite limited exposure to caring for people living with HIV. It's not been seen so much in the ARC sector to date. And so therefore, if we haven't had the exposure, that can sort of explain why we've had that limited understanding and knowledge. Again, training, most providers will give infection prevention and control training once a year. But again, extending that out to things like HIV is often not common. And limited training can impact limited knowledge. And so that relationship between training, knowledge, and belief is a really important thing to think about. We did note from our results, though, any form of training has a positive impact. So when we asked the question, what training people had, it had varied from a 1-hour course to a couple of days, to a few hours, or a continuation of development. And what that showed is any form of training can result in a positive impact around on knowledge, stigma, and worry. What we did, some of the knowledge that we did see is very much, the 1980 view of HIV. And so certainly in the 1980s, we did have some of that thing around risky behavior and sexual intercourse, but that has developed since then. And again, that occupational fear, so around double gloving, around getting the virus, around the feeling that standard precautions is not enough. And again, this does relate to our knowledge as well around HIV, how it's transmitted, and how we care for people living with it. Cool. So recommendations. So like most health priorities in New Zealand, there is a document by the Ministry of Health. This is a really great document, and it's our National HIV Action Plan for the next 10 years. One of the big goals in this document is to reduce stigma and discrimination for people living with HIV. And so and we'll talk about some of the training that is available. And certainly other recommendations for providers is looking at policy measures to prevent discrimination and protect those living with HIV, and around that professional development for staff around HIV transmission and management. So I will just give a bit of a promotion for this as well. So this was sort of developed in tandem at the same time I was doing my research by Positive Woman. It's an online resource. It's really easy to navigate, and it explains things in a really great way for staff around HIV. It's full of great videos of people with their lived experience, and does explain it in a way that sort of takes away all the myths. It makes people feel a bit more safe and secure if they were to care for people living with it. Just give an hour of professional development, and it has had really great wider stakeholder engagement. So not only from our organisations that support people living with HIV, people living with HIV themselves, but also clinicians, infectious disease specialists, academics, and those wider groups, which is really great. And certainly do encourage and promote it as much as possible. And that will bring me to just some acknowledgements. Certainly anyone who has done a master's level study can't get through it without your supervisor. So I just want to thank Raven and Sue for all their support. The staff who obviously participated was a really great undertaking. The survey was actually quite long, so it was about a 15-minute survey. So those who did complete it, I'm very thankful. Our stakeholders, of course, they have been really positive throughout. And then, of course, everyone today participating in this webinar, really great to share and share the findings, and happy for any questions. Also from here, our publication is being worked on at the moment. This project formed part of a wider University of Otago study looking at aging with HIV. So this was a quantitative side, but there is also a qualitative side that has been explored, and that publication is in the pipeline. So keep an eye out for it. All right, any questions?
Thanks so much, Regan. Does anybody have any questions they want to put in the chat or in the question and answer option? It doesn't, well, we could chat for a minute, but they might come up, Regan, as we chat.
Yeah,
Thank you
good.
so much. That was really interesting. I knew a little bit about it already, but it's great to hear it sort of all of one go. And as you say, in our country, it's not as common, but in some countries, HIV is very common. There was actually a piece in the paper the other day. I think Sue was quoted, Sue McAllister, one of your supervisors, who works on many aspects of the HIV area, doesn't she?
She does, yeah.
Quoted saying that the numbers have dropped. Would that be right? And
they certainly are, and I think a lot of that is due to probably our public health responses. Like we do have really great systems now for people living with HIV in terms of treatment, in terms of getting on treatment really fast. But also, you know, the other sides of HIV in terms of from blood transfusions or shared needles. You know, we do have shared needle exchange programs and things like that now. And so I think it does help with our numbers.
Absolutely. I have a couple of other things, questions, Regan. The applicability of this to you did your study, the setting was aged care,
Yep.
but in terms of the Health New Zealand staff Te Whatu Ora in the hospital setting, what would your recommendations be in terms of should staff be aware of someone with HIV that they're caring for? And
So it's I think it's a really interesting thing. So I think when we think about HIV, it's not a complex condition whatsoever. You know, so if in terms of managing someone, it's really around standard precautions, you know, if they're a stable person. So, you know, what I would indicate is people who are directly involved in that person's care, but I don't think it needs to be a blanket announcement that there's someone on the ward living with
Yeah. And the
and
same
we
could be said of a lot of conditions, actually.
Yes, absolutely, absolutely.
Yeah.
And I guess when you think about, you know, it's very much it's standard precautions,
Mhm.
and they are more prone to lots of other health related conditions, but you deal with them as that condition rather than HIV. Yeah.
Yeah. I also found it quite interesting in terms of your methodology. You mentioned that paper copies were more popular with the aged care population, and I think that's just a really good reminder to researchers that you have to be really mindful of the population that you're
Absolutely.
surveying or asking
Yeah,
questions of, and
absolutely,
a lot
absolutely.
of mine.
And I think on reflection, our survey was quite a large survey, you know, so it was, and so you know, think around time pressures and the availability to sit down and do, and you know, where paper option was far more preferable, actually, you know.
Carry it around with you, and I mean, I think that in terms of older people, you know, like doing things through QR code and app is fantastic for younger. And I'm making assumptions here because some older people will be able to do that too, but it doesn't suit all populations.
No,
So it's kind of good that you gave the option that you gave
yeah,
the option
absolutely.
of
We had quite we had 184 completed, but a high number of people who had started it and then stopped. And so I think people had started it, gone away, and hadn't come back to it. So that's why I also think the paper option was a lot better, you know.
You can do that on the bus, you know.
Yes,
Paper
exactly.
option.
Exactly. Yeah.
Yeah. Oh, that was really interesting, Regan, and congratulations on getting your master's through.
Thank you.
I don't think we do have any questions. We've got a number of people attending though. So could they, if they did have questions about things, anything that you've mentioned or anything further related, what is your email address?
More than happy if you just share my PS Otago email, so regan.gilchrist@psotago.org.nz.
Great.
More than happy to chat. And also, again, you know, if anyone was to get a patient or a resident like this, our stakeholder organisations are really open to hearing from people, you know, so I was really fortunate enough that I got to connect with both of them. And so they're really open to chat and help with development and advice and things. So, you know, there are those great organisations too who do amazing work. And so are an amazing source of knowledge.
Yeah. Fantastic. Actually, there is a question now from Joe Robertson. You might know Joe. Great research, Regan. Congratulations. Do you think it would be good to add HIV education to the learning requirements for staff in healthcare, or maybe use HIV patients more as case study examples?
Yeah, I got asked this exact question, Joe, at the Gerontology Nursing Conference a few weeks ago. I think, you know, our numbers are really rare, and so I think, you know, I'd hate for it to become just another thing that staff just are doing, and sort of the knowledge can sort of disappear. So I do think case studies, or, you know, if you're aware of someone's on the ward, having that informal education at the time, you know, because certainly with our numbers, you know, we could add the training in, but they may not have exposure to a resident living with HIV for some time. Or whether it's also helpful to just briefly touch on it when you do your training, because again, HIV is one aspect, but also when I did my lit review, other bloodborne viruses also very, very far and few between around our knowledge with that. So I think there's an opportunity for that as well.
Mm-hmm. And you can understand why people survey respondents said, you know, with addressing a wound or a bleeding,
Yes,
that they
yeah,
would have that concern. Yeah.
yeah, absolutely,
And,
absolutely.
and of
Yeah.
course, there is all the stigma that goes with HIV and the
Mm.
lots of popular myth as well. So yeah,
Absolutely, and we do know that the stigma is the number one barrier to people accessing care as well. So some of the research we're seeing is if someone experiences stigma on one account with a health professional, they just won't engage, and so we run the risk of people not being on treatment, people getting unwell unnecessarily. So yes, I think it's just a really important thing to be aware of.
yeah. Oops, looks like we've got another. Just Joe saying thank you for your response. Thanks,
No
Joe.
problem, Joe. Thanks for your question.
Yeah, that's nice. Okay. All right. Well, if anyone wants to contact Regan, it's regan.gilchrist@psotago.org.
Org.nz.
.nz.
Yeah,
Yeah, lovely. Well, thank you so much for coming along, Regan, and sharing your
pleasure.
results. That's fantastic.
Pleasure.
And kia ora koutou, and thank you everyone for attending. And the link will now be circulated. This has been recorded, and we'll get that sent to you, Regan, if you wanted to disseminate it through aged care as well.
That'd be great. Yeah, that'd be great.
Okay then.
Okay, thank
Kia
you so much,
kite,
Zoe.
thank you. See you. Bye. Bye everyone.